So Prime Minister Modi extending the current lockdown to control the spread of COVID-19 till the 3rd of May. He's also said any decision on easing restrictions in parts of the country will be taken only after the 20th of April, that too keeping in mind the difficulties that are being faced by India's poorest. In just the last few minutes, the Prime Minister has changed his display photograph in his Twitter account, and that is from the moment he began his speech this morning, and he has a scarf which he's using as a homemade mask, as it were. He was wearing it when he first came on. He removed it then to address the nation. But this photograph clearly an indication of wanting every Indian citizen to cover their faces as if at all they step out in these lockdown times. But the Prime Minister also talked about needing to ensure that the virus does not spread to any further parts of the country. He said we should be worried every time we hear about somebody dying. We must also ensure that new potential hotspots do not spring up. He also put out a 7-point charter for people to follow that includes social distancing, taking care of the elderly and the poor, protecting jobs and preventing attacks on doctors and other frontline COVID-19 workers when there have been worrying reports of ostracization and stigmatization of frontline COVID workers. Let me go right across to those who are joining us at this point. Raghav Chadha, MLA of the Aam Aadmi Party, is with us as we speak. Ankur Bhatia, Executive Director of the Bird Group, is with us. Amitabh Dubey continues to be with us as well. Raghav Chadha, are we now really going to hear Chief Ministers of States also outlining what's going to be done on the ground in lockdown 2.0, as we're calling it, stage 2 of this lockdown? We were expecting to hear from the Delhi Chief Minister yesterday. That didn't happen. Are we going to see some statements from him shortly also?
Well, yes, I think the Chief Minister of Delhi, as he conducts his regular press conference in the evening and gives a complete health bulletin for the NCT of Delhi, as well as the measures that he and his government are taking, I'm pretty sure that in the coming few hours, he will certainly address another press conference and point out or highlight the measures that his government will be taking in lockdown 2.0. And he was one of the chief ministers who actually suggested to the Honorable Prime Minister in the VC that the Prime Minister had with all chief ministers that the extension of a lockdown is necessary, especially in a city like Delhi. And I think the Prime Minister has taken into account the concerns as well as the suggestions made by various chief ministers. We have the benefit of learning from the best practices that have been followed across the globe as far as tackling COVID-19 is concerned, as well as lessons of failures from various countries. And I think one of the reasons why an outbreak of COVID-19 has impacted some countries pretty adversely is because the restrictions or the lockdown came in at a later point in time, because the community transmission phase in those countries had already begun by then. I think India has been proactive in that sense, and we have imposed the lockdown restrictions much before the community transmission phase had hit us. And I think lockdown is extremely essential to contain the damage of COVID-19. However, I think what I would have loved the Prime Minister to say, and I'm pretty sure that the guidelines that his government will issue will certainly throw some light on the following, which is how will the poor, the downtrodden, those who are at the bottom of the pyramid survive? What will be the financial sort of help that will be offered to them? Is there a thought out plan for making arrangements of food, their livelihood, so on and so forth? I think we in Delhi have come out with a comprehensive plan vis-a-vis providing daily meals, dry ration, as well as financial aid to e-rickshaw drivers, to auto drivers, to laborers, to migrant workers, so on and so forth. But it would be wonderful if the Government of India also throws some light on that as to how do they wish to address this extremely essential concern. But he did certainly mention in his remarks that the poor, the poorest of the poor, is what he'll certainly be looking at, and how do they survive lockdown 2.0.
And
Having
Raghav
said
Chadha,
that,
what kind of financial assistance would the Delhi government, for instance, be hoping for? Are you hoping that there will be some
Well-
kind of concrete announcement of that as well?
So the finance minister of the government of Delhi, Shri Manish Sisodia, has on a couple of occasions, requested the union finance minister as well as a few members of the central cabinet that the government of Delhi, do require some financial assistance. Mind you, we are not recognized as a full state as far as the Finance Commission is concerned, the 14th Finance Commission, and therefore the government of Delhi does not even get the share in central taxes. Every government in this country gets share in central taxes, which runs into several thousand crores. Unfortunately, because Delhi is not recognized as a full state, we do not get any money. We haven't got any money in the last 1.5 decades, and we survive on our own. And with the grace of God, we are a surplus government. We have a surplus budget. But in these, extraordinary times, the revenue of the government has also, fallen short of its monthly expenditure.
Right.
And therefore, a lot of austerity measures as well as, financial restrictions have been imposed by the Honorable Chief Minister when he said that only money of the government of Delhi will be used to pay salaries and nothing else, and no other expenditure will be sanctioned. We have requested the Honorable Finance Minister to give us some financial help. I am sure that they will consider that request of the Chief Minister as well as the Finance Minister of Delhi favorably, and some sort of financial help I think every state needs, the government of Delhi certainly requires.
Yes, indeed. Let's also get an industry perspective in from Ankur Bhatia, Executive Director of the Bird Group, who's with us this morning. Ankur Bhatia, would you have hoped perhaps for more details on what kind of easing of restrictions there was going to be post the 20th of April? The Prime Minister, of course, has made sure, has been very categorical that for the next week at least, this is perhaps the most critical period when there has to be, if anything, an even tighter lockdown.
Well, I think on the outside, I'm quite relieved and happy of the extension right now. While, as you know, that the industry and everybody is suffering economically, but I think human life is of more importance than anything else. And given the circumstance and given the numbers, what we are seeing of the cases going up, I think lockdown for now is the right thing to do. The Prime Minister also mentioned in his speech that they will come out with a plan after by tomorrow, and in detail that after 28th, if there are any green zones where there have not been any cases, to slowly open. But from an industry point of view, I think first intention definitely will be to curtail that, and to curtail that to a point that it doesn't come back again, because there is no point in sacrificing this time when we are looking into this situation right now of giving up work, and then we have a spike again. So first of all, it is very important to get and eliminate it completely. But I think the good part about India and the states, and I was, from Delhi as well, that our local economies are good and big enough that once we are able to eliminate this from the city of Delhi and we are able to open up, there would be ample amount of business which can be transacted within Delhi. Our economies are big enough the numbers are big enough as certain small countries in Europe. So I'm not bothered about the comeback. I think that can come back soon. But if there is any fear at all of an outbreak happening again, or if there is any fear, I think that is when it's going to be a problem of the economy turning back.
All right. Medically speaking, we're being joined at this point by Dr. Srinivas, General Secretary of the Resident Doctors Association of the All India Institute of Medical Sciences, which has been dealing with India's COVID-19 outbreak right from the very beginning. Dr. Srinivas, we heard the Prime Minister say that the next 1 week or so was perhaps going to be critical for India, and therefore it was even more important now than perhaps even before in these earlier 3 weeks to follow restrictions as strictly as possible and enforce them as strictly as possible. Tell us a little more about that, if you will.
It is happy to see the Prime Minister acknowledge the concerns of the people, the healthcare workers and society at large. But it is also important to note that how will common people have access to healthcare facilities because the regular OPDs are shut or they are operating at limited capacity? The important concern would also be to address the issues of non-COVID patients who need healthcare access. And as we know, even on a regular day, people would have difficulty accessing healthcare facilities. So how are we going to address those concerns during this pandemic is yet to be seen. Though the proposals are good, how they reflect in the ground is yet to be seen.
All right. Let's also get a word in from Amitabh Dubey. I think a concern that's been flagged repeatedly, of course, has been the concern about food and how we reach food to those who need it the most right now. We saw those terribly distressing pictures of a man and several dogs sort of trying to get a bit of milk off a street, milk that had been spilt over there, and it really sort of hit home what it's like for so many people in this country who have absolutely no food security at the moment. The fact that there are 77 million tons of stored grain, how do we reach that to the people who need it the most? It's going to be imperative for the government to outline all of those in the days ahead, surely.
Yeah, so the measures that the government took, whether it's the Jan Dhan transfer payments, PM Kisan and all that, and everyone acknowledged at the time it's a good first step. The problem with those steps is they have very high exclusion errors because not everyone has a Jan Dhan Yojana account, or at least a functional Jan Dhan Yojana account. And the people at the margins are the ones who get left out. And unfortunately, there's a large number of people at the margins, and that's why we see all of these issues. We have food stocks that are 3 to 4 times what we need them to be. So I think what I would like to see, and we've had 3 weeks go by already, but we still have time to take action, is perhaps a mission mode, a national emergency level activity to get this food to the people who are excluded from other means. Some states like Chhattisgarh, for instance, I know has sent food supplies even to people who are not eligible for PDS. So every panchayat has a certain amount of rice for people who may not fall into. So that's one way to deal with exclusion error. What's happened now is that the costs of exclusion have become very severe because of the very intense situation we find ourselves. So I would like to see the government to take very direct and overt and high level of energy actions, whether it is to get food, whether it is, well, there are many other measures, for instance, to help industry. A GST cut would probably help industry immediately as opposed to measures that take time. So there's a whole range of things. So I would personally like to see a high level of energy in addressing some of these very severe problems, because the steps taken so far are a good beginning, but don't go far enough.
Right. Let's get some reactions in from the states. Sam Daniel joining us at this point from Chennai, and Tamil Nadu, of course, has seen a spike in cases recently. Sam, what are you hearing? Are we likely to see sort of more steps being outlined at the state level in Tamil Nadu also?
Ankita, we are yet to hear a formal response or reaction from the ruling AIADMK in Tamil Nadu. The Chief Minister had already announced extension of the lockdown yesterday till the 30th of April, and now it's going to be 3 more days of lockdown according to the Prime Minister's order, and the state is in that sense fully prepared. And in terms of relief based on the ground realities or ground situation, at the moment of the 38 districts in Tamil Nadu, 34 have positive cases, and at least 17 of these districts have 20 and above positive cases, and Chennai tops this with 205 cases, Coimbatore 126 and Tirupur 79. So these may not at the moment receive any kind of relief or any kind of relaxation, but there are at least 7 districts which have positive cases less than 10, and these 7 to 10 districts many hope could get some kind of relief later. These include Perambalur, Ariyalur, Kallakurichi, Ramanathapuram and Tenkasi, and the top 3 of course are Chennai, Coimbatore and Tirupur. Of course, in terms of political reaction, the DMK says they are quite disappointed about the Prime Minister's address, because they say the address does not have any solution in terms of relief for large sections of the poor people, migrant laborers, particularly the industry sector, which was looking for a kind of an economic stimulus. Also, more importantly, they say the Prime Minister has not talked about enlarging the ambit of testing and also supplying states with adequate number of testing kits. For example, in Tamil Nadu, the consignment expected from China, 1 lakh test kits have been diverted to America. We don't have. So these are concerns at the moment. But PMK, an ally of the BJP, they welcome the Prime Minister's announcement saying that this will lead to further checking the spread of the virus in the state. This could lead to the state fighting it more effectively, they've said.
All right, thanks very much indeed for that, Sam. And it's an interesting point you raised there about PPE, about medical exports that India is doing at this point. Dr. Srinivas, I'd like your view on that. There's been so much talk really about the need for PPEs or personal protective equipment for our health workers here in India, or for that matter, debates about India's exports now of hydroxychloroquine, which is being seen as something that is needed for health workers particularly. Would you have liked to have heard more about sort of concerns that have specifically been raised by frontline COVID workers?
Definitely, as everybody has pointed out, the Prime Minister lists a set of concerns, but he doesn't offer clear solutions about how these are going to be dealt with. That is the real concern as a representative of the healthcare community also. When we extend the lockdown, do we have enough PPE when the lockdown is taken away? And do we have enough provisions for all the doctors to reopen OPD by wearing PPE? So PPE is a really important concern, and as we have seen, there is a surge of cases among healthcare workers. Hospitals have been shut down. There are even deaths reported in healthcare workers. So it is important that governments puts up some concrete plans to address the PPE shortage and ensure that healthcare workers are able to work safely.
And what about ramping up medical infrastructure, even as we look at sort of restrictions and the lockdown continuing? At some point, we have to look at a way of living with the virus, as it were. When restrictions are eased, we can't keep a country of 1.3 billion people in lockdown forever.
Definitely, government should look at long-term plans to ramp up infrastructure. The government has been spending very dismally, say like less than 2% of the GDP. So government should ensure that all the expenditure goes into long-term planning rather than looking at short-term options. Government should invest in government sector, and the facilities which are made available now should be available for an extended period for the welfare of the country, so that the country is able to have better health facilities even after the pandemic is over.
All right, I'm going to take quick last comments now. Raghav Chadha, before we wrap this up, what would be perhaps the best case scenario going ahead? Close coordination between the states and the centre. What is it that the Delhi government, for instance, would be hoping for?
Well, yes, first of all, there has been close coordination from day one. I think keeping aside political, ideological differences that one has had with the ruling dispensation, you have seen that from day one, whether it's the Lieutenant Governor, the Delhi Police, the Union Health Minister, the Prime Minister, the government of Delhi has worked in close coordination with all of the above. And I think going forward, working closely with the central government will be something that the government of Delhi will do, because it's a pandemic. I think the whole country needs to come together. All governments need to come together. The people need to come together to fight this. And community transmission is something that the community and community alone can stop. No government or no agency of the state can help us fight community transmission. Number one. Number two, I feel prevention is better than cure. As we say, as far as COVID-19 is concerned, I don't think prevention is better than cure. I feel prevention is perhaps the only cure. And that is the mantra with which the government of Delhi is going forward. We've made adequate arrangements for the food, boarding and lodging of the poor, the downtrodden. We have declared about roughly 43 places as containment zones where COVID-19 patients have been diagnosed. And those entire 43 places have been cordoned off. I hope that going forward, this number will not increase, should not increase, or should not increase by leaps and bounds. That would be prime focus of the government of Delhi. We have also started sanitization in various parts of the city.
Yes,
and
yes, indeed. The Delhi government is to be praised for all of those moves, but I am very short of time, so I'm going to get a quick comment in from Ankur Bhatia as well. Going forward, Ankur Bhatia, what is it that you would hope for clarity on from the government when it comes to at least easing some restrictions when that happens, whether it's after the 20th of April or even sort of further down the line, to just get some production back on track, whether it's sort of small scale, medium enterprises? How long can industry be completely shut down?
See, as I rightly said, as I sort of said before, that first instance is to save lives. So the first instance is to ensure that there is no spread of this particular virus. For this interim, I would like to also say that the industry should come together to do a support the needy right now. Our hotels in Delhi are actually giving food to 1,000 people for lunches and dinners in coordination with the administration and the police on a regular basis. So such efforts throughout the industry is important right now. But how does it come back? I think to come back, I think we need to have an elimination, or at least, which is the longer term thing, at least a cure, an antiviral or a vaccine to it. Now that we don't see coming right now, but we can always use this time to ensure that we are at home. We could all ensure that this thing doesn't spread. We could all ensure that there is social distancing, so that in the next weeks we are able to at least contain this to an extent that the industry can slowly open up and start getting into production again.
All right, quick last words, Amitabh Dubey. I do have to wrap this up.
Yeah, so basically the challenge for the government is to make sure that the after effects of the cure are not as bad as the disease itself. And as Dr. Srinivas said, we have to deal with COVID patients, but we also have to make sure that people with other problems, very severe health problems, don't get shut out.
Yes.
Similarly, we have to shut down the economy, perhaps in a more smart way, but we have to make sure that the economic consequences are not devastating in their own. And for this, I'd like to see much more from the government.
All right. We leave it at that. Thanks very much indeed to all of you for joining us at this point for our special coverage of the Prime Minister's speech. More guidelines expected tomorrow. And then, of course, it really is going to be the onus is going to be on the states and indeed even district level administrations to ensure lockdown stage 2. We'll continue to get you all the latest on that big story. For the moment, it's time for a quick break.